My name is Ali Harbour. I am the Deputy Head Pastoral here at Winchester College, and I also have oversight of safeguarding as I am the designated safeguarding lead. What that means in practice is that I oversee pastoral care alongside all the Housemasters, the second master, and of course I work very closely with the matrons as well as the staff in the medical centre team. We are really fortunate in terms of our provision in the Health and Wellbeing Centre. Not only do we have a fantastic team of paediatric trained nurses, we're also very fortunate to have 4 in-school counsellors, and we also have close relationships with 2 psychologists and 1 psychiatrist. And we are also working very closely now with Dr. Laura Francis from St Paul's as we have started our partnership with them.
At St Paul's Surgery, we strive to deliver the best service we possibly can to the surrounding area. St Paul's has been voted within the top 10% of practices for the last 8 consecutive years. We really focus a lot on the same GP seeing patients, so each patient has a named GP, and we think it's really important that we all get to know our patients and offer them the best care we can.
We're very lucky to have a St Paul's Surgery that helps support us look after pupils in the school, and the pupils are able to self-refer into her clinic and also be referred by the nursing team and also matrons accordingly. So when Laura isn't here, we're able to contact St Paul's if there's anything urgent or if we would like to have some more information on a pupil. Dr. Francis is able to ask us to order ECGs and just for routine examinations, as therefore you would not have to go to your own family GP.
Hi, I'm Sarah. I lead the counselling team here at Winchester College. So we have a fully qualified team of counsellors who are all experienced at working with young people, and we offer counselling sessions to students here at Winchester College. Pupils are able to refer themselves through the pupil counselling email address. They can also go to drop-in, which is run by the lead nurse, and discuss if counselling is something that would be right for them. We also can receive referrals through matrons and housemasters, and parents are also welcome to contact us through the pupil counselling email address. We offer a space to be heard where students can come and explore and process things that might be difficult for them. We also will offer coping strategies to help them manage things on a day-to-day basis. If a young person is accessing support outside of school, it can also be really useful for us to know this so that we are able to support them as best as we can within the school.
We recognise that the mental and physical well-being of the pupils is really important. They're living here, some of them are away from their homes, and it's really important that they're happy and well physically and mentally. And that also helps their learning capacity, their fitness, and is extremely important for these young people.
Pupils can access us 24 hours a day during term time. We have expertise in chronic medical conditions such as asthma, diabetes and epilepsy. The best way of helping us to help support your child at school is to register with St Paul's Surgery, because therefore we have access to their NHS medical notes, which is very helpful for us providing continuity of care.
Any information regarding your child's medical condition, any updates, any changes to medications, it would be really helpful if you could let us know here, and we can make sure that we've updated the records as necessary.
So supporting pupils is something that we do on a day-to-day basis, and that might be through the housemasters, the matrons, the house tutor team. It's one of the great joys of working here, both for boarders and for day pupils. Lots of us are here all of the time, and we have lots of conversations with the pupils, because we know that supporting pupils is very individual. What has worked for one pupil might not be quite the right thing for the next, and so we also want to be flexible and adaptable. It's particularly important that we do listen to what pupils have to say to us about the health and well-being across the campus, and we've been really delighted that some of them have come forward, or they've also fed back to us through surveys about what it is that they are looking for in terms of their well-being. We did talk more about how they would access that support and also how they might support each other. And Tutor Hour in particular has been a wonderful forum for doing that. It's house-based, so we have right through from 6 book 1 down to JP. So we've talked with them about positive mental health strategies, how they can look out for each other, and also how they can access that support that's available for them in the college, be that through self-referral to the school counsellor or indeed with a housemaster or with their matron. What we really prize is the individual, which is why, for example, our ECHO programme is so diverse. So they've got a lot of choice here as pupils to explore different options when they first arrive. They might want to try this activity, this sport, to then go on and specialise in whatever it is that they have chosen. The college allows pupils to make individual choices and for us to support them in those individual choices, and helping young people develop and identify what it is that they are interested in and therefore how they develop physically, emotionally, culturally, in terms of all of their interests. That is really at the heart of how we support wellbeing at Winchester.